Here's a story where going viral takes on a whole new meaning. We're talking about influencers, raw milk, and an actual virus that's spreading through American dairy farms. In 2024, while health officials warned about bird flu in the milk supply, sales of unpasteurized milk didn't drop. They exploded. And social media had everything to do with it. This is Internet Mythbusters. I'm your host, and today we're investigating how wellness culture turned a public health crisis into a sales opportunity. Picture this: a deadly virus is spreading through cattle herds. The FDA issues urgent warnings, and somehow, sales of the potentially contaminated product go up by 65%. That's not a hypothetical. That's exactly what happened with raw milk in early 2024. And the mechanism behind it tells us something important about how misinformation spreads. By the end of this episode, you'll understand exactly why people rush toward danger instead of away from it, and what the actual science says about the risks. Let's start with what we mean by raw milk. It's milk that hasn't been pasteurized, meaning it hasn't been heated to kill harmful bacteria and viruses. Pasteurization was developed in the 1860s and became standard practice because raw milk was killing people. Tuberculosis, typhoid fever, scarlet fever, all spread through unpasteurized dairy. Before pasteurization became widespread in America, contaminated milk contributed to about 1 in 4 foodborne disease outbreaks. The death toll was staggering, especially among children. But in recent decades, raw milk has made a comeback among people who believe pasteurization destroys beneficial enzymes and nutrients. They call it real milk or living milk. The FDA has investigated these claims repeatedly. Their conclusion? Pasteurization does not significantly reduce nutritional value. The enzyme claims don't hold up under scientific scrutiny. Despite this, the raw milk movement has grown, fueled by distrust of government agencies and a broader wellness culture that prizes natural over processed. Then, in March 2024, something happened that put this movement to the ultimate test. H5N1 bird flu was detected in American dairy cattle for the first time. H5N1 isn't your ordinary flu. It has a mortality rate in humans of around 50%. When it jumps to new species, epidemiologists pay very close attention. The virus spread through dairy herds across multiple states. And here's where our story takes a truly bizarre turn. As warnings increased, so did raw milk sales. According to PBS News, weekly raw milk sales rose between 21 and 65% from late March to mid-May 2024. Compared to the same period the previous year. That's not a typo. In the middle of a bird flu outbreak in dairy cattle, people bought more raw milk, not less. The question is why? CBS News found that wellness influencers with massive followings were actively promoting raw milk during the outbreak, often framing the warnings themselves as reasons to buy. The logic, if you can call it that, goes something like this. The government is warning against it, which means they're hiding something. Raw milk must be even better than we thought. Some influencers went further, suggesting that drinking raw milk during the outbreak would provide natural immunity. There is absolutely no scientific basis for this claim. As CBS News put it, wellness influencers often post personal and compelling testimonials in engaging videos that often go viral. Negative experiences are rarely, if ever, shared publicly. This is survivorship bias in action. You hear from people who drank raw milk and felt fine. You don't hear from people who got seriously ill, or worse. Now let's talk about what the FDA actually found when they tested raw milk from infected herds. This is where it gets genuinely alarming. CBS News reported that FDA testing found high viral loads of H5N1 avian influenza in raw milk from infected herds across 9 states. High viral loads. Not trace amounts, not maybe detectable levels. The virus was present in significant quantities in the raw milk supply. And here's the critical finding. A Stanford University study published in December 2024 confirmed that influenza virus remains infectious in refrigerated raw milk for up to 5 days. 5 days. That's more than enough time for contaminated milk to travel from farm to store to your refrigerator while the virus remains fully capable of infecting you. The Stanford researchers weren't guessing. They actually tested how long the virus survived under real-world refrigeration conditions. The results were unambiguous. In late November 2024, this stopped being theoretical. California recalled 2 batches of raw milk from a Fresno dairy after bird flu virus was actively detected in the product. That milk was already on shelves. People had already purchased it. The recall came after the fact, which is exactly how food safety emergencies work. Now, here's the good news for the vast majority of milk drinkers. Pasteurization works. The CDC confirmed that pasteurization inactivates the bird flu virus completely. According to CDC research, no evidence of viable virus was found in pasteurized milk samples. The heating process kills H5N1 completely. This is exactly what pasteurization was designed to do. It's been saving lives for over a century. The technology is not new, experimental, or controversial in the scientific community. Yet the Annenberg Public Policy Center found that only 17% of Americans knew that bird flu had been detected only in raw milk, not in pasteurized milk. 17%. That means more than 4 out of 5 Americans didn't know that the pasteurized milk in their refrigerator was completely safe from bird flu contamination. This knowledge gap is a communication failure. The information is out there, but it's being drowned out by influencer content that algorithms are designed to amplify. Social media platforms reward engagement. Fear-based content and contrarian takes generate engagement. Public health guidance is, by comparison, boring. An influencer saying, "I drank raw milk and I feel amazing" gets more shares than a CDC statement saying, "Pasteurization makes milk safe." That's the fundamental asymmetry. The FDA has repeatedly addressed claims that raw milk is somehow more nutritious. Their official guidance states that raw milk can carry dangerous bacteria, including Salmonella, E. coli, and Listeria. Those pathogens cause real illness. Between 1993 and 2012, raw milk was linked to 127 outbreaks, resulting in nearly 2,000 illnesses and 144 hospitalizations in the United States alone. Now add bird flu to that list. H5N1 isn't like getting a stomach bug. With a 50% mortality rate in humans, this is a pathogen that demands respect. Some raw milk advocates argue that their milk comes from healthy cows and small farms, so it's safe. But H5N1 can infect seemingly healthy cattle before symptoms appear. The California recall proved this point. That Fresno dairy likely thought their cows were healthy too. The virus doesn't announce itself before it spreads. There's also a political dimension emerging. The potential influence of vaccine-skeptic voices in health policy discussions has added fuel to the raw milk movement. Some advocates see raw milk as a symbol of food freedom and resistance to government overreach. The science becomes secondary to the cultural statement. But viruses don't care about politics. H5N1 doesn't check your voter registration before deciding whether to infect you. Biology operates on different rules than culture wars. The children most at risk from raw milk contamination are too young to have chosen any political identity. They're simply vulnerable to pathogens their immune systems can't fight. The FDA identifies infants, children, pregnant women, and immunocompromised individuals as being at highest risk from raw milk consumption. These aren't theoretical concerns. Pregnant women who contract Listeria from raw milk can suffer miscarriage, stillbirth, or premature delivery. The bacteria crosses the placental barrier. When influencers promote raw milk without mentioning these risks, they're not providing balanced health information. They're running an advertising campaign with omitted safety warnings. So what should you actually take away from all this? First, understand that pasteurized milk retains its nutritional value. The FDA has confirmed this through extensive testing. The idea that heating milk destroys essential nutrients is a myth. You're not missing out on health benefits by choosing the safer option. Second, be skeptical of testimonials that only share positive experiences. Survivorship bias is real, and it's amplified by social media algorithms that reward positive engagement. Someone who drinks raw milk and gets sick probably isn't posting about it. They might not even connect their illness to the milk. The feedback loop is broken. Third, know your risk category. If you're pregnant, immunocompromised, or feeding young children, the stakes of consuming raw milk are significantly higher for you. Consider whether a contested health claim is worth gambling with the health of your most vulnerable family members. The potential downside is severe. Fourth, check your state's labeling requirements. Many states that allow raw milk sales don't require warning labels. You may not be getting complete information at point of purchase. Fifth, follow legitimate food safety channels. The FDA and your state health department issue recalls when contamination is detected. Those notifications could be genuinely life-saving. You can sign up for FDA recall alerts directly. It takes 2 minutes and gives you access to the same information that triggered the California recall. And finally, consider what would have to be true for the conspiracy theory to work. Thousands of scientists, regulators, and health officials across decades all lying about milk? Pasteurization has been standard practice for over a century. The evidence that it saves lives isn't based on one study, it's based on the dramatic decline in milk-borne illness since adoption. The raw milk movement asks you to believe that this entire body of evidence is wrong, and that influencers with no scientific training have discovered the truth. That's not critical thinking. That's contrarianism dressed up as skepticism. Real skeptics follow the evidence, even when it leads to boring conclusions. Here's the bottom line. Raw milk sales spiked during a bird flu outbreak because social media rewards contrarian content over public health guidance. The virus doesn't care about your feed. It survives for 5 days in your refrigerator, waiting for an opportunity. Pasteurization eliminates that risk completely. When someone tells you that the experts are lying and they have the real answer, ask yourself who benefits from that message. Then check the primary sources. That's Internet Mythbusters. If you found this useful, share it with someone who needs to hear it. And we'll see you next time.